Well, raising a child is not easy. We all know that, right? As parents, you want to make sure they're on their best path to success. So what if you think your child seems like something is off, but you're not sure what's going on? This afternoon, we have Carrie Baker, a board-certified pediatric nurse practitioner, with us to talk more about mental health in kids. Glad you're with us today to talk about this very important topic. It's been, ever since the pandemic began, we've been talking about everyone's mental health has gone south, but kids especially, because they're at a formative age where they need to feel good about themselves as they develop as human beings. First of all, was the biggest part of it probably being out of school and being away from that socialization that's causing some of the problem?
Well, yes, I think it's always been a problem. I think COVID has just made us more aware of it. So yeah, I think COVID brought it more to the forefront of what was actually already there. I think it's being more validated and more recognized and more diagnosed now since COVID.
Because we all know that growing up is not easy for anyone, and the development ages, I mean, if you want to encourage them and help them flourish as a person, being away from their friends and peers and having to live a life on Zoom is not a way to grow and develop with personality.
No, and then they're stuck doing lots of social media, which adds a whole other layer and dimension to anxiety and depression in kids. So,
what signs and symptoms do you look out for in a child? What should a parent do when they're watching their kid and see how they're doing?
Well, anything that's a change from their normal behavior, right? So we start hiding in our room, withdrawing, grade starts dropping, lack of interest in things that they've had interest in before, changes in their eating behaviors or patterns, just anything that's different, that stands out. Parents are pretty intuitive, so if they're paying attention, anything that's really different and from their norm should be a red flag to a parent. Dropping grades are usually the first sign.
And also, if they're in school and not working, doing school from home, you can talk to a teacher, anybody else at school to see any observations they have. That's got to make a difference, right?
Yeah, talking to teachers, talking to their friends or their peers. Parents should also always monitor their social media. Oftentimes kids are saying things on social media that can be cues and red flags as well.
You don't really know how your child's doing really until you figure out there's maybe a problem. What can a parent do at home to start establishing what's going on and maybe try to help the child then before it gets really bad?
I think just being available, being willing to listen before you speak. Let them tell you what's going on. Be available for them after school. Be available for them after sporting events. Take the time to actually sit and be with them and listen to them and validate how they're feeling. And usually a child will open up and talk with you and tell you what's going on. And if you know something's going on but they won't talk to you, seek out help at your pediatrician's office.
And the dinner table is a very important part of that. And
absolutely.
That tradition has kind of gone away as we're all going our separate ways. Everyone's so busy doing sports activities, schoolwork, work obligations, things like that. We don't sit down and have a conversation with our child anymore. How can you overcome that?
I mean, making it a priority, right? Anything that's important to you, you make a priority. So family meal time, it should be a priority. Making a time before kids go to bed just to all gather as a family and,
it's a great idea.
Talk.
Yeah.
Set those traditions ahead of time when they're younger, and it becomes easier when they get older. Harder when they've got sports and things, but if it's important to you, you'll make it a priority.
So I decided my kid needs some professional help. What do? Go to the pediatrician first and start with that and see if they need further help, or would the pediatrician be handle that?
Absolutely. Start with your primary care provider. Some pediatricians are very familiar with and comfortable with diagnosing and treating different mental health behaviors. Some of us are even board certified in primary care mental health, so we treat it right in our office. And if not, at least that's a starting place, because then they can connect you with professionals who are willing to diagnose and treat if they're not comfortable doing that within the office.
So what would the doctor do when you have a little one-on-one session, or with the child and the parent?
Well, I'm board certified in primary care pediatric mental health, so I bring the patient and the child in, and there's different like screening tests that we do. We also talk about, you know, what's been going on, what are the symptoms, past history, just kind of listening and putting the picture together. We use something called the Diagnostic Statistical Manual for Mental Health. But basically it's just sitting and doing screening scores and talking and putting everything together to see if there's an issue.
And treatment, what's the next step?
Well, treatment can be a number of different things. Always counseling, right? Because there's not a magic pill. If there was, I think we'd all be taking it, right? Sometimes there is medication that's needed, and if it is, we go down that route and we talk about what it does with the chemistry of the brain, why you need it, how to use it. But I think oftentimes we can start with just counseling, but that's counseling and medications are your two treatments.
Carrie, we're out of time, but really love talking to you about that subject. Very important, and I think as we go down, there's the number for Maumee Bay Pediatrics where you work in Oregon. They're right by St. Charles Hospital. So if you have a question about it, give them a call and ask them.